P2 and other e-pills fail all the time. Now, we have reasons why this usually happen. I'm going to give you 8. And before you go there, P2 is just one of the e-pills, and the function is to make sure you don't get pregnant after having unprotected intercourse. Now, the reason number 1 is the fake drug. Sometimes you might buy a drug which is fake. Maybe it was just a placebo, and it means that that's not going to work at all. Number 2 is taking that drug when it's already too late. Now, if the drug was written that you should take that within 3 days, always make sure you do that. Some others are usually written that you should take that within 5 days. But the golden rule here is to make sure that you're taking that drug closest to the activity as possible. If you can take it immediately after that, the better. If you prolong that, then you're increasing the chances of you getting pregnant. Number 3 is taking this drug after ovulation. Now, some of the drugs usually function by inhibiting the action of luteinizing hormone, whose function is to facilitate ovulation. If you're taking this after ovulation, it means that you already have that luteinizing hormone and you already have an egg that will be fertilized. So it's going to defeat the purpose. Number 4 is body weight. If you have a higher body weight, meaning maybe your BMI is above 25, it means you're either overweight or maybe obese. You have more fat content. And because we are dealing with estrogen drugs here, it means that because of high affinity to the fats, some of that estrogen will be stuck in the fats, meaning whatever you'll have in the blood will not be sufficient to cause the action that you are looking for. Number 5 is other drugs. Now, when you're taking drugs that contain testosterone, remember you're talking about now the pills which contain estrogen that you're using to control chances of you getting pregnant. Now, if you're taking drugs that contain testosterone, these drugs are usually antagonistic, meaning that if you have a higher testosterone, it means that it's going to limit the amount of estrogen that you have. If the drugs that you're taking contain testosterone, they're going to limit the function or the work of this estrogen-based drug that you're going to take to prevent yourself from getting pregnant. So always make sure the drug that you're taking does not have the effect or the negative effects on the e-pill that you're going to take. Number 6 is vomiting. When you vomit after taking that drug, you're not going to have a good absorption into your blood, meaning you're going to have less of that and the drug will not function. Number 7, which is quite common, this is having sex after taking the pill. Now, if the function of the pill was to limit or to reduce the motility of the sperms, it means that you're going to add more that will not be affected as much by the drug and they're going to swim all the way up. Number 8, which is quite obvious, is you're already pregnant. If you're already pregnant, this drug will not work at all because it will defeat the purpose. If you're already pregnant, it's not going to do anything. So it's not going to affect the pregnancy at all at any point. So let's meet in the next video.